Hey everyone, so this is part 2 of our expert case assessment series, and today we're going to look at empathy and reflection. So understanding how this shadow domain, which your ex has scored highly for, how it shows up in family court proceedings. So the main problem is their perspective. They can't see your side, and we want to look at how do we show this to the court. If your ex can't seem to understand how their behaviour impacts your children, if they're always dismissing your concerns or turn everything into being about them, then you're watching someone with low empathy and reflection. And this shadow domain predicts how they'll respond in court when confronted with the impact of their behaviour and how this can impact your strategy. So, what is empathy and reflection? It's the ability to take someone else's perspective, to understand the impact of themselves and their behaviour, and then to adjust that based on their understanding. And when someone has low empathy and reflection, they struggle to see situations from another person's viewpoint. They genuinely don't understand how their behaviour affects others. They see concern about impact as an accusation or attack. They can intellectually understand the consequences, but they can't feel the weight of them. So they'll minimise or deny the harm. It wasn't that bad, or you're overreacting. And why this matters in family court? Well, courts are meant to assess whether someone can parent and co-parent responsibly, and that requires an understanding of how their behaviour affects the children. And low empathy and reflection is a critical red flag because it predicts resistance to accountability. They're not going to take any responsibility for their behaviour because without empathy, there's no acknowledgement of wrongdoing and therefore no motivation to change. If they've not done anything wrong, why would they change? And you hear that so much. It explains the dismissal of child impact. So when either you or other people are saying to them, this is impacting the children, they refuse to see it or usually blame it on someone else, you. They can't or won't see how their actions affect children's well-being and development. It reveals their inability to adjust. So even when they're shown clear evidence, they can't change. They just carry on doing the same things without making any modifications to their own behaviour. It signals that they will be resistant to court orders because as far as they're concerned, they're not doing anything wrong. So therefore the court order itself is wrong and is unjustified. So they won't comply with it. And ultimately, this indicates harmful modelling. Empathy is taught. We learn empathy through our mirror neurons. And so if we don't have that, then we can teach children to minimise their own impactful and harmful behaviour. And that affects their emotional development as well as their social, because if they lack empathy, they're going to struggle with meaningful friendships and relationships. So the difference between a normal disagreement and low empathy and reflection. So healthy perspective taking isn't about just going with the other person. That is people pleasing and fawning. So you can disagree with someone's view, but you can also you can understand and describe their position or your own. So you don't agree with their take on something, but you can describe your perspective and their perspective. So you listen to someone and you can take on board, okay, well, I understand that that's what you think. I just don't agree with it. They understand children, so this is healthy. They understand children are affected, even if they don't agree it's their fault. So they can see that the children are coming under harm, even if they're not willing to take full responsibility for it. They can say, I didn't intend to cause them harm, but I can see that it's affected them. They make adjustments when genuine behaviour and genuine impact is demonstrated, and they'll show concerns when their children are distressed. Whereas low empathy, they just can't or won't see or be able to describe your perspective because they're not looking, they're not interested. They're mirror neurons that what allows them to see past themselves. They're inhibited, they haven't developed properly. They deny that the children are affected at all, or say they're only affected when they're in your company. And they'll say if they're upset, then it's your problem for what you've done. They minimise harm as an exaggeration or manipulation, show no concern when children are clearly distressed by what they're doing, and they'll just keep repeating the same behaviours despite that impact. So let's have a look at how this specifically shows up. And these are kind of patterns that you want to be making a note of. So the dismissal of child impact. It's not my fault. That didn't really happen. They're not that upset. You know, all the things that you've heard in the relationship, really, they're going to say the same things about the children. The inability to take your perspective. So every conversation becomes them versus you and not a problem solving or a child focused collaboration, which is ultimately what co-parenting is. And I'm not saying that you're going to aim for co-parenting, because I understand that that's impossible, but this is about highlighting why it is impossible with this particular person. Minimization of harm. So if they don't see what they're doing as any sort of real problem, then they're not going to make any changes. They're not going to make things easier. They're not going to take on board any suggestions for how things might look and feel differently. It essentially keeps everyone stuck in that position. Child-focused impact denial, so they don't see the children as separate people with their own experience. So they assume that their children think and feel the same way as them. So if they're angry with you, then they assume the children will be angry with you. If they think that you're dangerous, then they think the children will think you are dangerous. Now, I just want to caveat that with saying, not all children think that lions are dangerous, but that doesn't mean that they're safe either. So I'm just caveating that particular bit, but you get the general gist of it. It's a blurred boundary between themselves and anyone else, because they need that person to essentially back up what they're thinking and feeling to make them feel better. They have an inability to adjust based on the impact. So there's no feedback loop whatsoever. They don't go, okay, I can see this is a problem, I'll make some changes. It's just, no, not me. I didn't do that. Not my problem to fix. So what courts see and don't see, and this is me being honest in terms of both my professional experience and being a social worker, and also my professional experience with working with these cases. They might label it as being different parenting styles, which is infuriating, but I've seen it so many times. But it doesn't. Courts should I should have put should there. Courts should recognise that it goes beyond stylistic differences and it's about capacity. They might label it as being he said, she said, but actually this is one side just refusing any acknowledgement. They might see it as coaching. They might think that actually the distress that you're reporting isn't true. It is, and what the children say, it's not real. It's not their lived experience. A good practitioner will know the difference between when a child speaks with their own voice and from an actual lived experience, and when they're not, but unfortunately not all practitioners do that. It can lead to the weaponization of children, because they see them as as extensions of themselves, so they'll use them as a weapon to hurt you the way that they're hurting. And this can lead to alienation, it can lead to triangulation of the children, it can lead to role reversal, where the child becomes the caretaker for that parent's feelings, and it can lead to DARVO. It can lead to, parents can also, the courts can see it as being DARVO. So when you make an allegation around, I would never say that empathy, by the way, I will come to that, but if you're displaying some of these patterns, then they might label it as being DARVO, and essentially, or your ex might, and they might go along with it, that you're the one denying actually what's going on, not the other way around. So it's very complicated, and in my experience, courts aren't great at looking at the empathy angle, which is shocking. So why this pattern exists, so the psychological roots. Again, this isn't about excusing their behaviour, but developmental factors. And again, it's talking about mirror neurons. So if their parents lacked empathy or were stuck in a traumatised state, then they weren't able to learn how to see from other people's perspective. And there might be trauma, neglect, or even overindulgence where their needs always came first. So, golden child can have low empathy, for example. Might be a narcissistic defense. So they don't want to hear your perspective because actually that doesn't match with how I need to feel about myself. So no, thank you. Their brain will just go, let's shut that out. That's going to hurt too much. A trauma response. Trauma survivors can struggle to extend empathy because they're hypervigilant to threat. So if they're being asked to see their impact, then it might feel like they're being blamed, and that might lead to a trauma response and completely overwhelm their trauma system. Neurological differences. Some personalities naturally are more self-focused, and that doesn't mean that they're bad, but it can affect their co-parenting capacity because they're only able to see through their own perspective because of their neurological disposition. Again, that is not me saying this happens with all neurological conditions. I'm just highlighting that it can be part, particularly there are elements of autism where they struggle with social skills because of that ability to see things that, like I said, don't make them a bad person. It's just something we need to consider. And alert patterns. So they were many of them were modelled low empathy in their own childhood, and so they don't even realise that anyone else has their own inner world, and that's important. So in terms of change, it's one of the hardest traits because they don't even see the impact. You look at, say, alcoholism. It takes someone acknowledging that this is having a negative impact on them, on others, for them to want to change it. But if they can't see, if they're still in that stage where everything's great and hunky-dory, then they're not going to want to change. And with low empathy and reflection, then they're never really going to get to that point where they see that. So why would they want to change? If anyone tells them that they're concerned, they'll just minimize it. So why would I want to change? It's not that bad. And they won't adjust their behavior because if you don't think that you're doing anything wrong, why would you make any changes? They shut down all the emotions that are telling them that something doesn't feel happy, or they blame everyone else for why they're not happy, but not look at what changes they could make within themselves. So if you put all these together, then there's low possibility for change. And it's important to say that therapy could help them. There are mentalization, CBT, DBT. These have been proven to work with cluster B personality disordered individuals. But for many of them, they can understand it to a certain level, but you've got to really do the work and take years and years and years of work and challenge yourself, challenge that version of you that you thought you were, to make those real, genuine, empathetic shifts. And courts are slowly, very slowly, getting more attuned to this. Essentially, if someone isn't going to change their perspective after 10 attempts, then they're not going to do it. And that's kind of your job to show that. What I would say is that CAFCASS have introduced an empathy assessment. Now, I haven't actually heard of a case that's used it yet. And as with any tool, it's only as good as the person using it. And so unless they've been properly trained on what empathy is and how to use it, then I'm not saying it's the answer and it's going to help. But if you find these patterns, you can definitely ask CAFCASS to undergo that assessment. I just wouldn't pin all your hopes and dreams on them getting it right. So that's my caveat. So how this impacts your court position. So these are the kind of things that you want to be showing, is that it's child safety here. If they've got no empathy, then they can't recognize when their children are distressed, and that minimizes the child's distress. So the child learns, actually, my feelings aren't important. Their credibility, because if they're, what you need to show is that they're self-serving, that they're not really talking about the children, they're talking about what's best for them, and all the decisions they've made about the children have been about them and what best suits them. Also, if the children are parroting, they want the same things, I would be pulling that up as well. And because what we want is independently thinking children, and that's not to say that, you know, people can't want the same, but everyone will have different reasonings. So if everyone's parroting the exact same thing, that's a warning sign of low empathy and reflection, amongst other things. So parenting capacity is poor responsiveness to children's actual needs, because they're focused on themselves. They're not looking or thinking about the children's needs. Non-compliance risk. So again, document all the times that they haven't, they've resisted or violated court orders. Alienation becomes a massive risk because they can't separate the children from the conflict and they want to weaponize them. So they'll involve them in adult narratives without empathy for the burden that that creates. And accountability. So you want to be showing that this person is not able to take any accountability whatsoever. So what this means for your strategy. So show what they're denying, how the children are effective, and their resistance to perspective, as well as, and probably most importantly, the observable child harm. So let's look at what that looks like. So I'm going to show you a 3-layered system of the child impact, their dismissal of the impact, and their denial of observable reality. So for each incident where their behaviours affected the children, write specifically what happened. So where possible, use quotes or as much detail as you can, just about what you observed. What exactly happened? An ABC chart is a really good thing to get used to using. What the child saw or heard. Again, use their words. If you weren't there and the children are relaying this to you, you've got to use their actual words. So use quotation marks to say what they actually said. Recording. I personally, if your child is upset, I personally don't agree with recording them at that point. Simply because, and I understand why parents do, so this isn't a criticism, I'm just giving you my reasoning here. I think your primary responsibility in that moment is to regulate yourself and your child, rather than, and if your first thought when your child is upset is, I need to document this, then you are coming out of that present moment and you're jumping into a trauma response of, I won't be believed, or you're leaping forward rather than staying present. So in my opinion, and there has been some legislation that's been introduced, or guidance rather, that's been introduced around recording children that kind of fits with that logic. I do understand why people do it, but I just think help your child regulate first, then go back and use their quotes. So list 5 to 10 specific incidents, note the date, what happened in the child's response, and then show whether that impact was acknowledged or dismissed. Again, just to know, at some point, stop telling them what's happened, because, you know, it can create a battle. And so, I would look at this on a incident by incident basis, because it can get twisted both ways. But you can, you know, if it's something that you feel you need to speak to them about, it's about showing how they responded to it and then showing that repeated pattern. So document their dismissal. So all the times you've attempted to tell them that the children are upset or struggling, how they've responded to that, whether they've ignored you, whether they've come out attacking you, or whether they've dismissed it, and then show that pattern. It's happened multiple times. And then the observable. So who else has seen this? You know, what is that child experiencing? How is the child showing distress? Are they crying? Are they withdrawing? Are they almost, children can become, what's the word, so used to it that it kind of, they shrug it off now, which again that's a trauma response for the child and doesn't minimize the impact that it's having on them. Are the schools seeing anything, or anyone else? And what behavioural changes is this happening? So again, an ABC chart can be really useful to look at that. So documentation tools, the child impact log, so a chronological record of all incidences, communication trail, so all your emails that around this, and then that pattern analysis. How often and how frequent and how consistent is this happening? And then what's being seen? What's the observable impact summary? What not to do? You don't interpret it. Don't try and mind read why it's happening, even though you know better than the court why they're doing it. You don't tell the court why they're doing it, because it steps out of the remit. It undermines your credibility. Don't diagnose, so don't use the words, obviously, narcissist. I feel like I'm preaching to the converted with that. Don't assume intent, so they're deliberately hurting them to get to me, for example. Don't put that in. Don't make it emotional. So this is harmful and damaging. Talk about it in terms of that actual child impact, as in the specifics of what's happening. And in the tools that I share, I always use or give you examples of what that would look like in professional terms, and don't put words in the child's mouth. So don't, like I say, when you're using quotes, use what the child actually said, not your interpretation or because any changes that you make is you putting words in the child's mouth. So just describe it specifically. So, for example, child cried for 40 minutes. State observable facts. So they've been told of this 12 times. Use the child's own words, quote them. Show the pattern, how many times it happened, and stay factual and concise. So the court, this is what I want you to show the court. This is what we want to get across, is this pattern of denial, this unwillingness to adjust, that the risk that this poses to the children, that it undermines their credibility because everything that they say is deflection and inability to take any responsibility, and that this is a trait, not a situation. You've mapped this over multiple different occurrences. Show that the court order aren't going to fix this, and that's a difficult one, but we kind of want to get this message across as early as possible, is that your concern is that they're not going to listen and court orders aren't going to work. Obviously, the further you go through, you can document that and say they breached this, they didn't do that, they've done that. And that the children need structure by having a detailed court order that protects them from these, from the lack of empathy and reflection. And how this helps you in your position. So rather than seeing you as two parents who can't communicate, you have one parent who can't see the other person's perspective, so therefore we need structure. Rather than parental conflict, it's one parent's behaviour affecting the children and showing no empathy. They need to understand. So if they're, blaming you in any way, then they've been repeatedly told dismiss it. The problem isn't about understanding, it's about a lack of empathy. So maybe, we look at parenting courses. So for some parents that might work, for others they might intellectually, but they can't put it into practice, so it wouldn't work for them. If you're high on this range, it's not going to work, and maybe therapy can help. So therapy might, but it requires them to actually acknowledge that they need to make some changes, which is the difficulty. So this gives you a strategic advantage because it's irrefutable. You're not interpreting, you're just documenting what happens. It shows a pattern. It's not one incident, it's multiple. And it shifts the focus from, you're not saying they're a bad person, you're saying it is, how is this impacting the parent's ability to parent your child and what impact that might have on the child. It can predict future behaviour. So you can say they won't make any adjustments and they won't stick to the court order, so this is what we need. It supports those protective measures because flexibility is risky. They're going to abuse any ambiguity within court orders because they don't think they're doing anything wrong. And ultimately it protects the children because regardless of your ex's view on it, you've got documentation that shows that they are being impacted by this, regardless of the reason. So the bottom line is the core question: can your ex see how their behaviour affects your children? The people from your results, the answer to that is no. So it's about documenting that. I hope that's helpful. I do conduct a report which involves taking your results as well as an assessment of their narcissistic traits and providing you with an outline for how to present that in court, how to present safeguarding risks. If I will provide the details for that in the rest of this email. But take care, everyone.